All right, thank you. Welcome back, everyone. Government Operations and Military Affairs, 1 p.m. on Friday the 4th. Now it's after crossover. We're bringing some folks in for a little bit more than introductions to subject matter, just so we can have a good understanding of the portfolios, and it's good information for new members and good refreshing ones. So we have some friendly faces over in the gallery. And I guess we will start with Mr. Burke, if you don't mind joining us. How you doing, sir?
Very well. Good afternoon, everybody. I am Robert Burke. I am the Director of Veterans Affairs for the state of Vermont.
And yeah, we were just like hoping to have you come in and just have you talk a little bit about like the organization, like the scope of like what your charge is, your capacity with how you engage with veterans and whatnot, and just kind of keep it high level and maybe a little Q&A as we go.
Sure. So we are part of the military department. I work for the Adjutant General. So unlike a lot of other states, mine is not a cabinet position. I'm a standard run-of-the-mill state employee. So the office is right across the street here, and we have three main lines of operation. So we help veterans file and certify their eligibility for state programs. So we have a property tax reduction program if you are 50% or greater disability rating for the VA, and towns through legislation offer a $10,000 to $40,000 reduction off the assessed value of your property before taxes are applied. And that is voted town by town at town meeting. And so that is set by the towns. So we determine people's eligibility for that program. There is the Vermont Veterans Fund, which is a grant program that is conducted yearly. And so we solicit applications for that grant program. And then there is a governor appointed committee, then reviews those once a year and distributes those funds. It's anywhere from 20 to we've had as much as $75,000 in that fund on an annual basis, and grants typically run anywhere between $7,000 and $12,000 to $15,000 per grantee, and we typically get anywhere from 8 to 15 applications per year. And of course, we do for individual veterans, there's registrations, automobile registrations for different license plates, veterans designation on your driver's license, hunting and fishing through Fish and Wildlife, and state park passes. That's through your town clerk. And there's a couple of other various state eligible programs for veterans to take advantage of. Then we have service officers. So we often talk about upstairs, downstairs. The service officers are upstairs in our little two-story building, and the service clerks and myself are downstairs. So service officers are upstairs. So they help veterans and their families apply for benefits through the federal VA. And that's for disability benefits for spouses and families. That's pension or dependency for survivors of veterans who had a disability rating. And so they work with families and dependents to file those benefits on the federal VA. And so just as an example, for in fiscal year 2023, we recovered $9.5 million in federal monies for veterans and families. Last fiscal year 24, $7.9 million. And so far this year, as of the end of March, $4.6 million of money that we brought into the state on behalf of veterans and families. And then the third is we operate the Veterans Cemetery down in Randolph Center. And in 2017-18, we did a $7.4 million expansion, which gave us another 1,640 burial plots. And so we certify veterans and spouses and some dependents eligibility to be buried there. For dependents to be eligible, you have to have been determined to be disabled prior to the age of 18 to be eligible as a dependent. And then, so we determine eligibility, we put everything away in a file. And then when the time of need comes, we set up either with a funeral director or with the family to set up arrangements for those interments, casket or urn to take place. And we set those arrangements up through funeral directors or directly with the families. And so there's no charge for the veteran. The only charge for a spouse or dependent is an opening and closing fee, which has only been raised. So I joined the office in 2014, and we've only raised that once. We'll probably will raise the fee again. So it's for perpetual care. And so the cost right now is $225 for an urn, $525 for a casket. We probably will raise that fee next year, again, because our operating costs, labor, equipment, fuel, et cetera, continues to rise. But I do a survey every couple of years throughout New England to see what places are charging and try and keep them competitive. The only place that doesn't charge is Maine, and they have a charitable foundation that they established some years ago, where the charitable foundation raises money and pays for spouse and dependent open and close fees. We don't have such an organization here in Vermont.
But you're not mentioning the price hike so that people will rush to beat the increase in cost.
Still the best deal around.
Yes.
There is no plot fee. The plots are provided by the government. The headstones are provided by the government for the spouse, for the veteran and the spouse. With the expansion that was done, everything's a shared lot now. So for urns or caskets, they're pre-placed double depth vaults. So the vaults are there. Families don't have to purchase a vault as they did in the old section. So those are provided at no cost to the families. And all of the headstones are then provided. A single headstone on the shared lot is provided. So both the veteran and the spouse's information is on that singular headstone. For the flats, they're both on the flat marker. For the upright markers, it's veteran on the front, spouse on the reverse side.
Stone.
I'm nosy. I'm on the website and it says any Vermont resident who is a veteran who has been honorably discharged from active duty in the U.S. Armed Forces, they're eligible for a lifetime day entry pass into the parks. What about people who are currently active? Do they not get a free park pass? What? Can we change that?
With the you.
It's up to you. You can change that.
I believe the answer to that question is yes. Have the capacity as a legislative committee of jurisdiction to have that conversation.
And I tell people, and I have a book at the office, 99.9% of what we do is covered by a piece of legislation.
Yeah. Well,
You don't-
62, so you can't get.
Because the
female
national-
pass.
We don't make this up as we go along.
and free,
National parks as a retiree are free.
but not active. Why are they?
And I think what Toby.
Okay, we'll workshop this one.
We can workshop that.
Yeah. Mr. Rapport, you were talking about grants and, various avenues of like dollars that you have in to help support these things. And, a lot of us have been taking a look at the conversations happening at the federal level. How much of your grant capacity comes from the federal government? Gotcha.
Zero.
Okay.
So the only federal funding, received no federal funding,
Okay.
right? The only federal dollars that I talked about was what we get for, what we recover for veterans through what claims we file through the federal VA on individual veterans' behalf. Right? There is no, so we have one person in the office who is the terminology is they are an SAA. They are a state approving authority. It used to be a position that was over in the Department of Education. It moved to our office in a long time ago.
Sure.
And so they are a contract person and they go around to institutes of higher education and training schools. So beauticians, electrician training programs, welding training programs, UVM, Castleton, you name it. So any institute of higher education or training program where somebody's going to use their GI Bill to pay for that educational program or training program. She goes and audits them for curriculum, how the program is run, how the school is managing the money part of it. So she's not a GI Bill specialist. She's basically a VA auditor. And so her position is a conditional, right? As long as the funding is there from the VA, she has a state employment position. If that funding goes away, that position goes away. It's conditional. I can't remember the exact HR wording.
Sure.
But that's the only VA funding that we receive for the office.
And first time we really had you in here within this context, I guess. And I guess I'm riffing off Rep Stone right now with this sort of looking at something we could do. But we have a little bit of capacity this time crossover. I didn't know if you had any flags for us policy wise or statute wise that you'd like the committee to take a look at. You know, I'm just kind of asking a probing question right now. If there's anything that you have on like a wish list or punch list that we could consider or take it.
Well, I mean, certainly for the last decade, we've talked about the retiree and survivor income tax exemption. Certainly as not only a benefit to the veterans, but we've talked about retention of retirees and economic growth. I think we've kind of beat that one senseless.
Yes, we are well aware of that one being on the punch list.
Yep.
I appreciate.
Yeah.
Yeah.
And I get it. We're a small state. We're constrained in what we can do. But I can't think off the top of my head. I think we're generous to veterans. A lot of bigger states have, mental health and physical health programs specifically for veterans and do a lot of other outreach programs, but we're a very rural state. So that's hard to do. I think one of the biggest areas, if I could pick one, would be transportation. Some sort of rural transportation network. That is always one of the hardest things, is getting people to appointments, shopping trips.
I was just gonna ask what kind of scope, but it's kind of everything, right? It's like shopping day to day, like all of that stuff, right?
Right.
Trips to the VA.
Rep stuff.
Yeah, medical appointments,
Just all of it,
right? Yeah.
Speaking of healthcare, I'm on this soapbox, everyone knows what to say. It is really hard to find providers who accept TRICARE in this state, and the VA is really far away. And I've heard more providers like nationwide are dropping TRICARE because of reimbursement rates and other reasons. It's like a pain. It took me and my husband a long time to find a dentist near Chittenden County for me. And I'm just wondering if that's a service that y'all offer, because there is like a TRICARE website that you can look at, but then you call the providers and they're like, half of them haven't accepted TRICARE in 5 years. Is there any service to help? No, it's just gonna be me on the phone for hours at a time and more providers in Vermont dropping TRICARE.
Unless,
It's a problem.
nothing, I mean, having been on active duty in a family dealing with TRICARE, maybe we were just lucky. But, you know, I live when we ended up here and my family settled in Cabot, I was on active duty down in Fort Rhode Island. And we were lucky to find a dentist in Hardwick that was accepting patients. St. J, no. Danville, no. We finally were able to get in to a dentist in Hardwick, and that's where we have been going since 2008.
I'm in Burlington. And it's hard. So I was wondering maybe if you have any ideas of how, I don't know if it's even legal to incentivize providers to accept. It is, like, any
Yeah,
ideas?
it's because of, you know, there used to be TRICARE East. Now everything is TRICARE West, which only complicated.
That's your conduit.
Yeah.
Yeah, so it's even harder now. And it was not easy to get providers paid before. I can only imagine it's harder now. And they're just done. They're like, not gonna put up with it. It's unfortunate. You know, because in everything here, this, now I'm 10 years old in this, but everything used to be TRICARE remote. Because in the prime, sorry, in other states, you had different levels of TRICARE.
Depends on your status.
Because of your status and density of providers and things like that. But I would not want to be in the TRICARE game right now. Sorry.
And I think too, that credentialing is difficult.
It's a great program as far as paying for it. It's just finding those providers is.
Why are they not, why, so what is the situation of providers where they don't want to engage? It's just.
I think it's a little more
Is it the sum, is it the process, all the above?
Yes.
It's a little more cumbersome.
Bureaucracy of the like
It's-
processing of the, all,
Yeah.
yeah, okay.
Yeah, I mean, I'm eligible for TRICARE for life, but I stick with my state insurance
Can't find
Because people take it.
because I don't want to deal with it. It would be cheap, it would be less expensive, but do I want to deal with that blank pain?
Yeah, is the time and the anxiety worth the money? Yes.
No, it's not.
Pissed off.
Say that I'm lucky because I'm in the southern part of the state and I have never had any trouble finding TRICARE providers.
Same.
Is there like a map?
I think it's hit or miss.
From like around the states? and we could-
Although-
That's what she was asking.
TRICARE providers? Is there a map of TRICARE providers?
That's,
I think if you go to the TRICARE website,
it's not
you're
accurate.
gonna see it.
I was going to say,
It's
not
not
up to date.
accurate because it's not overseen by a Vermont entity like y'all. And so whoever's running it, I mean, I have called so many, like, it's more for specialty providers, like,
OBGYN.
yeah, all of these that you need,
go to GP.
and they're like, we haven't accepted TRICARE in 5 years. Like, it's not up to date. And it's a real pain.
Yeah, I guess I just fall into that med lucky category as well.
And I'm not in a
Same
rural
here.
area, so I can't imagine what people in the Northeast Kingdom do. They just don't get their teeth cleaned, like,
Well, I know when my husband was dying, Dartmouth dropped TRICARE, like, he was getting chemo, like, what do you mean you're not, it's
Dartmouth?
like a problem.
Dropped TRICARE?
Pharmacy, yeah.
Oh, pharmacy, okay, okay.
But all of his medication coming out of the pharmacy,
Yeah.
No, but still, I think that's like the whole.
yeah.
All right. I guess that's something we can consider poking up, but I don't know what the.
That's a.
Bernie.
Yeah, I was gonna say that's-
But it isn't. I mean, on the flip side, it's just finding providers that are willing, they gotta be willing to know that it's gonna sit a little longer to get their money than a standard
And you know, it's,
Blue Cross Blue Shield.
the same thing is happening with choice under the VA.
Mhm.
You know,
Hmm.
getting a provider through the VA can refer you to
Community care.
community care, thank you. But again, it's delay in getting payment that people don't want to enroll in community care anymore because of the bureaucracy and the delay in getting paid.
So, and I know this is kind of like an open-ended question with unknowns, like watching what the conversations are in and around like resources being dwindled at the federal level. Is there any like thing you're specifically keeping an eye on with those conversations that could impact your work? Trying to get an assessment of some people's.
I'm trying to keep my finger on the pulse of what's happening. I'm not a big Twitter follower, reactive,
No.
not on social media. It's a waste of time in my mind. I try and keep the bigger picture of what's happening down at the VA Medical Center, White River Junction, what potential impacts that will have on not only there, but then at the community-based outreach outpatient clinics, the CBOCs. Vet centers are a different animal.
Sure.
So they're a lot more sheltered, but I think you'd have to reach pretty far to get to them.
Negative impact.
Yeah. So the VA in general has been looking at restructuring for a number of years, and there had been some proposals for New England consolidations and some changes that really got shut down hard 2 years ago. Would they have been improvements? I don't know. I mean, they talked about shutting down Newport and Littleton and putting a bigger, more service-oriented place in St. Jay. Might work, but that all got shut down in DC. So I have not heard of a significant reduction in personnel or services at this point in White River Junction.
Let us know if you hear otherwise.
I do. I reached out to the director and we get monthly updates from the director. So
Rep. Hoover.
So what do you do in Bennington? If a vet comes in to plans on with dry care?
Different animal.
I have the Veterans Home is their own standalone state agency.
They're not,
I purposely don't get involved.
no nexus to TRICARE that I'm aware of with them. I don't think.
I think a lot of these.
I think most of those people probably on Medicare by then.
Yeah, at that age.
70% service connected.
That's their biggest thing, because then they get the full rate.
I can just throw shed some personal light on it as a user of CBOC Burlington, community-based center, as Bob was just explaining. No change there, no change in staffing, no change in services. In fact, and it's just the hard truth. I was just telling somebody this the other day. I don't think I've ever waited more than 5 minutes, literally, past my scheduled appointment time in Burlington or White River, ever. I mean, ever. I mean, they are like, boom, Johnny on the spot with their timeliness. Whereas civilian dogs I've had in the past, I've sometimes been like 45 minutes later, you get in from your scheduled time. And as far as the services, again, you got to have that service connection to be able to go, like me, BL, kind of thing. But I've seen zero impact there at this point. But I know people keep saying, well, the veterans are going to take a hit, and I don't see that coming. But that's me, and I'm not trying to defend nor put down any piece of that. But it's just I don't see that anything's going to radically change.
No, and You will find nowhere in the state where you can walk in and get same day mental health help
Like you can there.
like you can there.
Yep, you just got to
You
go,
can
I'm in crisis.
walk in the door
Yeah.
and say, I need to talk to somebody, and you will talk to somebody. And you will get follow-on scheduled help, not in 6 months, but in a week. Somebody will see you that day, and then you will get an appointment within a week.
I can attest to that.
Yep.
Anything else for Mr. Burke right now? Thank you for your time, sir.
Thank you, sir.
Thank you.
All right. Miriam, how are you? Come on up.
Uh-huh.
We're gonna see her Tuesday.
How you doing?
How are you?
Yeah, not bad. So, yeah, it's kind of the same thing, like, just a good overview of your role, what you do, and
Absolutely. Good afternoon. My name is Miriam Boyle. I am the Director of Family Programs for the Vermont National Guard. I want to thank all of you for having us here this afternoon before your committee. Joining me from Family Programs is my Vermont Veterans Outreach Program Manager, Mr. Andre Wing. He'll be kind of giving you more detailed analysis of what we do. I'm kind of doing the overview. First and foremost, I wanted to make sure that all of you had our 24/7, 365 call center phone number. And that is 888 607 8773. This call center is manned by the Vermont Veterans Outreach personnel. And this should always be the first step for our veterans if they need assistance to call this 888 number, because it is manned by personnel who are veterans themselves 24/7. We get calls from community partners, law enforcement, VA, social workers, families, even neighbors who are concerned about the veteran next door. There are no menu options. There is no press 2, then press 3, and then press star. I also like to say that we'll never make you listen to Kenny G music.
that's good promise.
If the outreach specialist happens to be on another call, we have a voice mailbox, and that outreach specialist will call back as soon as they're able to. So again, 24/7, 365. The Vermont Veterans Outreach began in 2006 and was funded. Funding was secured by Senator Bernie Sanders through the National Defense Authorization Act of 2007. At that point, it was for the purpose of connecting with the global war on terror veterans who were coming home with serious physical, emotional, and mental health issues. And they had no guidance on how to access the resources that they needed. Today, the Vermont Veterans Outreach consists of a program manager, a program analyst, 12 outreach specialists covering all 14 counties, a VA liaison who is at the White River Junction, and 2 dental specialists, which I'll talk about in a moment. Our outreach specialists are embedded in the communities in which they serve. They are housed in the armories located in those communities and are connected to the Vermont National Guard leadership. And they're there to assist the units. We have a lot of National Guard members who are veterans from either past deployments or active duty members who have transferred to the Vermont National Guard. We were the first state to receive this type of funding under what they call the Yellow Ribbon Reintegration Program, or what we call it today is Beyond the Yellow Ribbon, BYR money, as it's known today. In 2013, the RAND Corporation came and did a study of all the states that were receiving this funding. And at that point, there were 10 states that were getting this funding. I did bring a couple of copies of the assessment for Vermont in case anyone was interested in reading it, plus the website that you can go to, the RAND report, to learn more. Today, there are 22 states that compete for this funding. This is a year-to-year congressional appropriations supplemental funding. And needless to say, it's very competitive. However, our outreach program is one of a kind. There is no other program like this in the country. So we're very unique. The program is robust, established, and nationally recognized. I mentioned before that we have 2 dental specialists, and I'm going to expand on that. We all know how important dental health is for veterans' health and longevity. But unfortunately, unless you're 100% service connected with a disability, you don't get any dental benefits. This leaves a lot of veterans without any recourse. In December of 22, with the help of Bob Burke and his office, we were connected with Northeast Delta Dental, where they provide us with grants that allow us to connect with federally qualified health centers around Vermont to assist veterans with their basic dental needs. And Andre will expand upon that in just a moment. I've been with family programs for almost 14 years, the last 2 years as the director of family programs. I have witnessed the outreach team working with our veterans, stakeholders, community partners, congressional delegates, and the like. The issues are often complex and difficult, but the team does not shy away from that. It makes them more determined to help. The team is made up of veterans, mostly combat veterans, and they truly have saved lives over the last 18 years. These are dedicated men and women who pledge to take on the mission of caring for our veterans. I wanted to just follow up with what Bob had mentioned, in that you probably already know this, but Vermont is the most rural state in the country at 65% rural. So it makes it very difficult sometimes to connect with veterans in the state. And that's why it's so important that this program, the outreach specialists, are embedded right into the communities. I also wanted to say that probably the biggest issue that we have is financial. And as Bob mentioned, the transportation piece, a subset of the financial is automobiles, auto care. We all know that Vermont is very rough on our cars, and winters are long. So that's probably one of the biggest issues I see. And with the transportation outside of Chittenden County not being, what we would love it to be, it does make it very difficult for our veterans to get to their jobs, to their VA appointments. And then they're usually driving beat up vehicles that are on their last leg. So we try to work with all of the different programs that we've identified that can assist us. And Andre's team is so good at finding these resources. So I have brochures for the Vermont Veterans Outreach Program. And like I said, the RAND report. Does anyone have any questions for me?
Yes, no.
Is family programs what used to be family readiness, or is that something totally different?
That was something different. We had what was called FRISAs, Family Readiness Support Assistance. They no longer around, we've absorbed what they were doing. So family programs, umbrella includes family readiness.
That's what I was.
It is challenging, having this funding be year to year. So family programs is made up of federal employees, federal programs, but also state contracts as well as federal contractors. So, yeah, we have a huge program within Vermont. We're lucky.
Anything else? Oh, I'm sure we'll be having some more conversations at the Super Bowl, so.
See you Tuesday, right?
Yeah, absolutely. Please, sir.
For military month of the child.
Yes, sorry. So every year we come and we have our military families come and hear the proclamation read on the House floor. Usually the first Tuesday of April, because April is known as Month of the Military Child. So,
Are we doing a gathering with families? We used to do them in our committee room, but we were combo packing that with the public space. So was that booked downstairs and not in here?
I don't think they're in the room. You know what room they gave you, Miriam?
I thought we had like room 10.
That's why we did it before, because we were piggybacking our committee.
Yeah,
room.
exactly. Meeting.
Right, so they're not
Yeah.
taking over this. Yeah.
Just want to make sure what we had moving through the rooms.
Yeah. So it'll be the proclamation and then Mary and I are working on some words for the floor. And there'll be some kiddos here.
Yes,
Some parents.
yes, we will. Yes, we will. Yeah. Thank you.
Okay.
Come on up, sir. You're the last one on our punch list for the week.
It's always good to have a Frenchman last. So my name's Andre Wing. I'm the program manager for the Vermont Veterans Outreach Program. I want to echo a couple of things about Bob said about obviously, as Miriam mentioned, I have 12 outreach specialists out in the field in the armories. I am not a VA employee. I'll repeat that. I'm not a VA employee. The reason I say that is because a lot of folks will call our 888 number and think we work for the VA, and we just have to kind of delineate. But I have a lot of contacts. I have relationships with the executive director as well. And they've been trying to reduce staff for the last couple of years. I think my concern would probably not be on the healthcare side, but on the benefit side. Of course, everybody had to come home or go back they were working remotely, and then a lot of them had to go back to White River Junction, and it was mostly the benefit side, which will do your VA home loan, your VA compensation, things of that nature. So I know of 3 people that were working remotely and decided not to go back because they didn't want to go back to White River Junction. Transportation is an issue. We've partnered with Rideshare Vermont. The VA has a transportation service that semi-robust, I would say. We used to in Chittenden County or in Lamoille County, we used to have a Green Mountain Transit that would go from Morrisville all the way to Chittenden County, and then they would be able to go to the CBOC in Chittenden County, the appointments that's no longer there, or maybe come to town to do shopping because they can't transport. Let's see. So there's 38,000 veterans in Vermont, and about 52% are over the age of 65. So I'm going to probably go all over the place here, but our dental program with Northeast Delta Dental. So like I said, there's 52% are 65 and over. So our clientele, our veteran clientele, are mostly the older veterans who hasn't seen a dentist, and God knows, well, some people have been for a long, long time. So we partnered with Northeast Delta Dental. So we were able to get, so it's $100,000 grant, $750 per veteran, for the calendar year. I upped it to $1,000 based on you know, what we saw, last year and the costs and whatnot. But, so last year we saw, where did I put that down? We had 70 veterans, so we didn't really start going till about maybe March or April, because I had to work with we decided to go with federally qualified health centers, and Rutland County, Riverside is not on board. And that's our two largest, clinics or veterans. So, we're still working with those, but we saw 70 veterans and we dispersed about $25,000 for veterans for their care. I anticipate there'll be more this year because obviously we upped the grant from $750 to $1,000. The federally qualified health centers that we've utilized are fantastic. I mean, we've got, one veteran was telling me that, his wife will be able to go to the dentist now this year because we're paying for his dental care because they would alternate who would go see the dentist. Right. So, and then I got a lot of stories like that. So we're proud of that. I just a little disappointing with the federally qualified health centers. As a matter of fact, I got in touch a dentist from New Hampshire, Hanover, called me about something. So I went over to talk to her because I'm like, oh, we don't have nobody on the eastern side of the state, I-91. Come to find out she was an Air Force veteran. And so she's covering our Orange County, Windsor County veterans, only Vermont veterans. So last year she saw about 12 veterans, but they're Vermont veterans and we do the vetting. And so that's been good. Who we serve anybody that does not have a dishonorable discharge. Okay. So, a lot of folks, Mr. Morgan probably knows this, but a lot of folks think that if you're in the National Guard, you are a veteran, and that's not true.
You retired.
Huh?
So you retired.
Well, if you don't have a Title 10 deployment. Right?
Yeah, other than
Or
that,
active duty. So the reason I say that is because there's people. I was just talking to a veteran yesterday, or a guard member who was retired was not happy because he couldn't get the vanity plates or whatever. Mr. Berg's probably dealt with a lot more people like that than I have, but and that's a statute that the federal government put in there. So, but if a National Guard member do go on a deployment, then they're considered veterans, and then we help them enroll. So, like I said, we will serve anybody that does not have a dishonorable discharge. If they have a general under honorable, we'll help them out. Out of those 38,000 veterans, there's about 9% or 3,500 that are female veterans. Just for whatever. So we've seen since the program started, and we've got a very robust database now. And at the very beginning, we were just hitting those deployments, from Iraq and Afghanistan or whatever back in 2008. So we really have our database is like top notch right now, and that really came about 6-7 years ago. But we have 10,000. We've seen 10,000 veterans since the program started, and how they access. So they access them through community partners, AgeWell, VA social workers, hospital social workers, the 888 number. I do a lot of briefings to different community partners. I finally did a briefing last May with all 300 VA social workers. And then I got a lot of calls after that. And the reason, and my thought process is that, if they're the social workers, so we're not what do they call us? Non-clinical caseworkers. And as Miriam mentioned, all my guys were veterans. My folks are veterans. Most of us are combat vets. So we can talk their lingo. We can be at there, and then we will meet them at the table. We'll deal with the families and whatnot. Let's see. So one of the things that, for the National Guard, we send representation. So my folks are embedded in the armory, so they know the soldiers. Because they, I tell them, you gotta go see them once a quarter. During their drill, make sure that you know who they are or who you are or whatnot. So we've already established a relationship. So when they get ready to go on their deployment, they may have anxieties or, most of us have deployed. But so they go on their mobilization for a year, they come back, they will see us at the demo site. And so, how you doing? How's it been? How was your deployment? Blah, blah, blah. And then what we're gonna do there is we will do a VA enrollment. So in this last deployment, there was about 1,000 people. So so I sent folks to the demo site over a period of 6 weeks, I think it was. And I always align the outreach specialist with the unit that they support. But we wind up enrolling about 850. And then we just dropped the enrollment forms at eligibility, which we have a great relationship. And all these folks were enrolled in the VA. So what that does for our VA, that's about 6,000 per enrollment of funds they get from national VA. So, we discussed, other things at the demo site as well. I'm big on doing community capacity building, or we have over 100 partners, and I get calls I get calls all the time. One of our biggest community partners, the Office of Veterans Affairs here in Montpelier, because the veteran will contact the front office there, and they'll explain what the situation is, or car repair, mortgage, some other stuff. Even some are, about getting their VA benefit letter so they can get the property tax exemption. And it's, you got to call Andre at 802-338-3022. So, and when they had the flood, we actually, last year, we were kind of taking their calls for them, part of our, collaboration with the Office of Veterans Affairs. Let me just make sure I answered all the other. So one of the things too is, like I mentioned, I'm big on collaborative partners. We have over 100. Age Well, Council on Aging. I mean, there's so many. Hunger Free. So we were with all the council. My staff was with all the council before COVID, and then obviously COVID, shut everything down, and then they're starting to do in-person meetings. And I know now everybody's like, we got to do Teams, we got to do this over Zoom. So we've re-engaged them, and then so I was talking with the executive director, Honora, and there was no veterans voice at the state level to talk about food insecurities. Okay, so then I thought, I'll volunteer. So now at least, I may not know all of the, at least I can provide some input because, if you have food insecurities, it doesn't matter if you're a veteran or not. One of our staff members in White River Junction does a farmer's market every Wednesday with a partnership with Willing Hands out of New Hampshire. And they provide 30 food baskets once a week to veterans. They go to the vet center. And then I think there's a couple of deliveries that she'll do because they're older veterans. I got a lot of stuff in there. I got a big folder, but what I tell folks, and I'm going to tell you folks here, you have our brochure, date number. One of the questions like, how do you access our services, or I would encourage a lot of times we deal with your constituents, obviously, because, they need whatever. I work very closely with the congressional delegation. A lot of times I'll get an email from, their head social worker. Hey, I got this situation in Island Pond, blah, 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 blah. And 90% of the time we've already dealt with that person. But there may be a new issue. So we'll go out and find out, what the issue is or whatever. We always call back. So, and about the TRICARE thing, I just remember that Katie Van Ace from Senator Sanders' office, who's our state rep for Senator Sanders, is working diligently on the TRICARE issue.
Okay.
Great.
I know her very well.
Okay, so,
Yeah.
and I think the, I have, my wife is a federal employee, so I have Blue Cross Blue Shield. I have TRICARE and I do utilize the VA. So I'm a very fortunate one where I don't have to pay nothing. We don't pay nothing for our healthcare. If you're, someone had mentioned that, you don't have to be service connected to utilize the VA. You can enroll. The one thing that you probably, this is a federal issue, but, I remember working with a Vietnam veteran with 2 tours who in Newport, he was in North Troy actually, who was 70, who had never enrolled in the VA. And when you do the enrollment forms for the VA, they do a means test. So this guy had 4, 5 very successful insurance businesses, but he made too much money and he didn't enroll them. And so the way to go around that is to submit a claim so he can be service connected for hearing, which is an easy one to do for 10-9 or whatever. But that's something, it's not at your level, but I want you to be aware, but I've spoken to the Codel about this on numerous times. It's not correct. I mean, and this was like a 3-year process because he didn't, listen, F the VA, whatever, I'm a Vietnam vet. I saw an APOM and he was like, and especially the way they were treated when they came back. But, so we backdoored it with, now he's got hearing aids, but we shouldn't have to go to those things. But and then Katie and her staff and President Ballant and, Senator Welch, they also are aware of that stuff, of that too. We got so many success stories. I mean, we are, as Miriam mentioned, we are the boots on the grounds. I mean, we will go to the veterans' house, talk about what their issues are. We want buy-in, obviously, but we want to make sure that the family member is also at that kitchen table when we talk, so that, because they need to have buy-in. We're also, when the VA or any social worker calls, they're nice people. And they may not be able to have the opportunity to say, you know what, you need to tighten up your bootstraps and let's get to work on this. But so we're like the bad cop, because I have no issues telling the veteran, it's an honor to serve, but they can, I don't have an issue. My staff don't have an issue telling you need to do this and this, that to get yourself better or whatever, I guess is what I'm trying to say without doing some cuss words there. But,
Tough luck.
yeah, tough love. There you go.
I got a question from Rep. Pistol here.
Yeah.
I have a question, and I'm still not sure why they do it, but I just had to renew my husband's registration on his truck. And he always had a specialty plates and first sergeant SG. So since he passed away, I wanted to get him a veteran's plate, and I was not able to get one because he's deceased.
That's a question. for
That
Mr.
is
Burke.
the most ludicrous thing. I said, I want to do it in his honor. And they're like, sorry. And then I had his DD 214, I had his death certificate, I had everything with me. And they're like, no, he's not eligible because he's dead. And I'm like, well, so if you have a veteran's plate and you pass away, you have to give it up.
You should have just.
Yeah. They're trying to do the right thing.
I'm just telling you what you should have done.
I know.
What you should have
Yeah.
done is what? It's
Yeah,
just.
Just renew it.
Renewed it.
You should have just mailed it in and renewed it.
And not.
Do you still have the 1SG plate?
Yeah. Yeah, my kid will actually.
Well, you have the plate, but you didn't renew
No,
that.
no, I did. I ended up getting an AF, whatever. But
Oh,
now,
that's
so now I'm just gonna go get a gold star.
Yeah,
Yeah.
you can do that.
Yeah.
But it still just ticked me off. I'm like,
Yeah.
no, he's a veteran. I want to honor his veteranism.
You're in a very unique, fell through the cracks situation, unfortunately.
Again, that's in the legislation.
All the park passes.
Along this part.
Yeah. But yeah, you know, circumstances.
passes on the park trail. I heard ya.
That's terrible that a widow would have to, you know, a veteran has a license plate and then he or she passes away and the widow or the family member has to give that plate up.
Because it belongs to that person. For a little longer, yes.
It's a bad thing,
Jointly registered.
way to look at it, but it's it's the sad starting reality, unfortunately.
Like, family of the veteran.
But so just the last thing.
Hard one. Yeah. I want to be conscious of time. I got.
No, that's,
I got
That's the whole last thing we were.
a meeting starting at 2:15. I want to be conscious.
But, so we're also part of the governor's challenge, you know, with the suicide prevention. So if you go through the Department of Mental Health, Mission Connect Vermont is what I think it's labeled. The SAMHSA and then VAs are represented, but I'm part of the lethal means portion of it. So basically, Dr. Klein from the Department of Mental Health will go to, so we've been to ERs, emergency rooms to do a briefing. Basically, and I forgot to bring those, but one of the things that we're trying to tell the emergency rooms when there is someone in crisis, a veterans obviously, is to ask the question, do you have military experience? Don't ask if you're a veteran. Do you have military experience? And that took us a long time to get that through people's heads, because if you say you're a veteran, most female veterans will say, we're not a veteran, or they'll say, I didn't go to combat. I'm not a veteran. So that's why, we're teaching that, and there's a presentation, and we also bring cable locks or gun locks, so they can have them in the ER, so that if they've got for safe storage of weapons and what of that nation. So that we've done Townsend, which it's a little Cottage Grove, little ER down or emergency room. Like, give me a while to get down there. We did Middlebury. We did we haven't done Rutland. We did St. Albans. We did St. Johnsbury, and then you're just waiting on other ERs to want to do the training. But it's there's three components to it, and it's like the governor's challenge. But
It's not speaking fast.
so, but putting your questions.
Anything for Mr. Whiting?
No, I think it's great, all the stuff that you offer.
Yeah.
Yeah.
You need to educate people that it's there.
Yeah, these folks, their phones ring off the hook, all three of their offices, I guarantee you. They get a lot of business. Unless military critters.
All right, well, thank you for your time.
Thank you all.
Thank you so much. All right, folks. We got some stuff framing up for next week, but we're dialing in the agenda. Autumn's not here, as we all know, so that stuff will get fired out to you once we get it a little bit more formatted, when she's feeling better, but there won't be any surprises. It's all the stuff we've been talking about. Thank you so much for all y'all for coming in today. We'll be chatting more in the near future, I'm sure. That wraps the week on government operations and military affairs. Close us out. Thank you. Take us off.